This is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur, on the 31st of October in 2022. The candidate's name is Feba Anna Stanley, and the candidate number is 3302. The interlocutor is Shyam Panon, and the interlocutor number is 4217. This will be roleplay number 1 for the profession of nursing. Good morning, Feba.
Good morning.
May I please see your identification?
Sure.
Thank you. Okay, you can have it back. All right. This is a test of your English language and not an assessment of your professional knowledge. So keep that in mind and speak as you naturally would in any situation. I'll take you through a warm-up session to get you started. This is so that you can get adjusted to this environment. This session is not in any way assessed. All right? So, Feba, why did you choose to become a nurse?
Thank you for asking this question. Really, this is a wonderful question. There are several reasons to choose this profession.
Right.
First of all, I have such a great compassion to all other human beings. That's why I choose this profession.
Right.
And many people influence me to select this one, especially my parents also influence me. That's why.
Okay. What are the current trends in your profession?
There are several trends, tremendous trends in nursing profession. First of all, the evidence-based practice is the main one. That means nowadays we following the scientific rationale while we doing any of this procedure in the clinical setting. And this is the main thing. And second one is telecommunication.
Right.
This is also give a great change in our nursing profession.
Okay. What do you think are some of the qualities a good nurse should possess in order to excel in her work?
The nurse should have the quality like good communication skill. This is the main thing every nurse should have, because every part of life we always interact with patients.
Right.
And on the same time other health team members also. That's why it is very essential beginners she should have this quality of communication skill. That's to maintain good rapport with others for this purpose.
All right. Is there someone in your life that you consider a role model?
Yes, definitely. My sister, she is also a nurse. That's why I choose this profession. She influenced me a lot.
Okay.
She has such a caring, protective companion. She's a good companion for me. That's why.
Okay, that is wonderful to hear, Feba. Let's move on to the role play now. You will be given 3 minutes to prepare for this, okay? And then we'll continue on with the role play for 5 minutes. Don't worry if I stop you in between. It just means that your time is up, okay? I'll be taking the part of the patient and you will be taking the part of the professional. This role play intends to get evidence of your ability to effectively communicate with your patients. So before we begin, do you have any questions?
No.
All right. So you will have 3 minutes to prepare for this role play, like I've said. Here is your card and some paper. Okay. You can take notes if you wish to do so, and you may also look at the card during the role play. I will need it back returned to me once we have concluded. Okay, I hope everything is clear. We will proceed now. You can begin preparing from now.
How can I address you during the role play?
You may address me as James. Okay, Feba, that concludes your time for preparation. Now we'll proceed with the role play. Like I've said before, 5 minutes is how long you'll have. I'll stop you in between. You don't have to worry about that. We will begin starting now.
Good evening, James.
Good evening.
My name is Feba. I'm the nurse working in this emergency department. How is your child?
Well, my daughter was brought to the emergency department following pain and things like that. So she has gastroenteritis and dehydration from what I understand. And I'm not sure how to proceed.
I can understand your concern. No need to worry about that. From your child case note, I understand that her doctor is advised for insertion of cannula for the administration of IV fluid. Am I right?
Yes,
James?
yes, yes. The doctor has advised for the insertion of intravenous fluids, but I don't understand why she can't just go back home and drink lots of fluids instead.
Medcity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
I can understand your perspective. No need to worry about that. In your child case, you already know that she have this gastroenteritis and dehydration.
Yes.
And in this case, she is unable to tolerate with oral fluids and also the oral medication.
Right.
That's why we are administrating fluids through intravenously. That means the medications and IV fluids are administrating directly into the bloodstream.
Okay.
This is what going on.
Okay.
And other than this, do you have another concern?
Well, I understand the reason for the insertion of the cannula, but won't it be painful?
Your question is reasonable. I can sense your feeling. No need to worry about that.
Right.
To reduce the pain, first of all, we will apply a numbing cream above that arm.
Okay.
And at the time, her pain will be reduced.
Right.
This is a minor procedure.
Right.
That's why no need to worry about this.
Okay.
And sometimes she could have a slight discomfort over the area. As you know, she's just only 7 years old.
Yeah.
She will be very naughty and there is chance for the displacement of the cannula.
Right.
So that we will apply a dressing over that region. Is that okay for you?
Yeah, that sounds good. But my daughter absolutely hates injections, and when she sees a needle, she is most likely going to start panicking. What can we do about that?
I can understand your concern. In that case, we will do certain strategies. I will explain in detail about that.
Okay.
First of all, while I'm inserting the cannula, I will explain the procedure step by step to her.
Okay.
At the time, I can distract her.
Right.
Or other ways, I need your cooperation. Is that okay for you?
Yeah, that's perfectly fine. I'll be with you all the way.
That's really appreciable thing. And at the time you can tell her her favorite stories or her favorite song. You can
Right.
sing for her, or we can use her favorite toys
Right.
while I'm inserting the cannula.
Yeah.
This way we can distract her while
Okay.
inserting the cannula.
All right.
How does that sound?
That
James?
sounds really wonderful, nurse. Thank you.
Yeah. Do you have any idea about the treatment?
No, I don't. If you could just walk me through it.
James, I will explain more detail about the treatment of your
Right.
child. First of all, we will administer the first dose of intravenous fluid.
Okay.
Then after, I will reassess her condition, whether she is getting better or not. And if her condition is not getting better,
Okay.
we will administer further fluids intravenously.
Okay.
And also there is a further possibility for overnight stay in this hospital. Is that okay for you?
Well, my daughter has never stayed overnight at any hospitals. Every single time we consulted a doctor for any kind of diseases or conditions that she had, we always went back home. So this is first, definitely. And this is a bit concerning for me.
James, as a loving father, I can sense your feelings. But in your case, as I already told you, that if her condition is getting worse, the doctor will ask to admit her in the ward. At the time, we will transfer her from the emergency department to the ward.
Okay.
And on the same time, you also can stay with her.
Okay.
Is that okay for you?
Yeah, that sounds wonderful. Now that I know that I can stay with my daughter when she has been admitted to the hospital. Thank you.
James, I hope I have clarified all your doubts. Can
Yes.
I do the insertion of cannula?
Yes, you can proceed with the procedure now, nurse. Thank you so much.
Thank you, James.
Okay. All right, Faber, that concludes your speaking test. You may return the card to me now. Thank you.
Thank you.
Download Medcity OET app, available on Play Store and App Store.